Hello everyone, I am Dr. Gourab Bhaduri, consultant gastroenterologist at Manipal Hospital's Broadway. Here I am to discuss an important topic regarding the preventive measures that should be taken for viral hepatitis, particularly hepatitis A and E during this period of monsoon. As we know, hepatitis A and E are mostly transmitted through contaminated food and water. That is, these are enteral bone infections. So, this hepatitis A and E, as in the monsoon season, there is often contamination of food and water because of this excessive rainfall as well as inadequate storage facilities. There is an increasing incidence of hepatitis A and E. In most of the scenarios, these hepatitis A and E patients usually have fever, followed by easy fatigability with or without jaundice, and very rarely they progress into acute liver failure, which is a fatal complication where the patient usually has jaundice with altered behavior and high coagulopathy. This hepatitis A and E can be prevented by consuming filtered water or boiled water when we are not sure of the quality of water, proper sterilization of the food items, eating freshly prepared fruits, and also storing cooked food separately from the raw foods. And as far as possible, we should avoid consuming stale foods or foods that are inadequately preserved. So this hepatitis A and E can be easily prevented by taking these preventive measures. And also another important factor is maintaining the hand hygiene. That is, prior to taking any food, we should always wash our hands with soap and water, taking the proper steps, and around 2 minutes time should be spent in our proper hand washing. Whenever the patient is having any of the symptoms of viral hepatitis like fever, jaundice or easy fatigability, he or she should consult a physician and follow his advice accordingly. To conclude, viral hepatitis is definitely a menace, particularly A and E in this monsoon, which can be easily prevented. And also another important preventive measure is vaccination of hepatitis A and E. Specifically, any child, all the women of the reproductive age group should be specifically vaccinated with hepatitis E during this monsoon, because hepatitis E, we know that in case of pregnancies has a very has quite a serious outcome. In normal patients, only 1% fatality occurs, whereas in pregnancy, the fatality due to acute hepatitis E infection increases to 20%. So I highlighted about this particular preventive measure of vaccination, particularly for women of the reproductive age group. And if we follow these hygienic measures, then we can definitely prevent contraction of hepatitis A and E in this monsoon.